Within the tapestry of society, leadership roles are the norm. Much is expected of us, especially our men. Many times men are overlooked, including in the realm of health. Yet they face some of the most prevalent issues such as strokes, lung conditions, and various forms of cancer. This is Caribbean Medical TV. We are on location at the iconic Queen's Park Oval in Trinidad and Tobago, one of the oldest cricket grounds in the world. Our focus today is men's health.
My name is Dr. Arthur Burnett. I am a professor of urology at the Johns Hopkins Hospital in Baltimore, Maryland, the United States, and you are watching Caribbean Medical TV.
I'm Dr. Mike Mills, and you're watching Caribbean Medical TV, the region's most impactful healthcare program. Please stay tuned for more information.
I'm Dr. Lester Goetz. I'm a consultant urologist and secretary of the Caribbean Urological Association, and you're watching Caribbean Medical TV.
Our health is our wealth, plus our health is our responsibility, Our health should never be the responsibility of your doctor or your nurse. It should be your own responsibility, and you should take care of your health because that is what's going to save your life.
So a lot of men have this false sense of security, one of due to ignorance, and they want to do deliberate, careful, that I just don't need to know. How do we pay to get bad news? That if they don't know, they just don't. They have a rational excuse. We also have very high incidence of diabetes, hypertension, and obesity. These are diseases we can make a major cutback or cut down if we do early intervention and people pay attention to the individual and general health. And take care of yourself. We don't exercise enough, we eat badly because of our sedentary lifestyle. We spend a lot of time looking at television and on our computers or iPads and our fancy phones. We don't exercise with the religious fervor that we should, because a good exercise program, healthy eating, would prevent obesity primarily and also hypertension and diabetes.
Generally, the key to prevention is adherence to your treatment regime, is adherence to your diet, adherence to your lifestyle changes. And another big problem in our society is obesity, which we tend to think is normal. But obesity can be a contributor to the chronic disease like hypertension, diabetes, strokes, and heart attacks and so. So we have to be aggressive in encouraging and educating people to adopt lifestyle changes to get to the ideal body weight as much as possible to prevent those chronic diseases.
So the key thing is that the digestive system is connected to every aspect of your body. So you need to have a proper nutrition to make sure that your body is functioning optimally. If something goes wrong, don't ignore it. If there are symptoms there, it may seem simple, but the important thing is to have a reasonable explanation for everything and get it done early. So lifestyle changes in this day and age are, fast approaching. In fact, probably epidemic proportions. So diabetes, hypertension, obesity, these are the large ones in our region. The digestive system is affected very heavily in each of them. Fatty liver is something which is very common and is not as well recognized, but it's a condition which we need to pay attention to. Cancers of the digestive system, which are related to all of your nutritional disorders, obesity in particular predisposes to having cancer of almost any aspect of the digestive system. So we just want individuals to pay attention to what they're putting into their bodies, making sure that it's nutritious, whole foods as much as possible, cut back on processed foods, fatty foods, making sure that if there's something which is not agreeing with their body, that you're paying attention to what it is, trying to eliminate it, speak to your physician, make sure you're doing the appropriate screening tests at the appropriate age.
Think about it. You might be the only sole breadwinner of that family. And yes, you are busy up, down, trying to get everything done and not taking care of self. Now, what happens if you happen to get a stroke, right? It means the whole family has a stroke. So they don't have a stroke physically, but mentally they have a stroke, because who's going to take care of that family? Children have to go to school. Books have to buy. Who is going to look after that family when that breadwinner has a stroke? It's a lot.
What is a stroke really? The blood vessels, the arteries take blood to every single part of the body, including the brain, including the heart, including the kidneys, because all those organs need nutrients, they need oxygen. So it's like the pipe system in the body. Now imagine what happens if you cut off the blood supply to the brain. If you block one of those arteries, one of those pipes, and that region of the brain is not getting blood, it will be deprived of oxygen, it will be deprived of nutrients, and the cells in that part of the brain die. And this is what we call a stroke. This is if it's a clot blocking that blood vessel. Now, whatever part of the body that region of the brain control, you may lose the function of that part of the body, so you may end up with a weak arm, a weak leg, loss of speech, visual problems, depending on the region of the brain affected.
Everything, men in general, not only confined to the Caribbean. It's a worldwide issue because men, unfortunately, especially in the Caribbean, we are not proactive in our health. Women are more proactive in taking care of their health, in getting to the doctor, in seeking help. Men are unfortunately not proactive, and they often present with things that are late. The prostate cancer, the colon cancer, the pancreatic cancers, cancers where they may have had a discomfort in their abdomen for, it's just gas, They drink a little lemon juice or some ginger tea and it settles down and they go about their merry way. Men, unfortunately, are just delinquent in looking after their health.
Some of the other things we see as an intern is multiple problems. We see people with lung disease, we see people with asthma, we see people with chronic obstructive lung disease, the smokers, for example. We see people with kidney disease, yeah? We see people with heart disease. So somebody may have angina or so. We manage those patients in conjunction with the cardiologist and so. So we manage multiple medical problems.
Protecting the lung health is important. What we need to do, we need to recognize the ability to be able to breathe well. You need to stop the things that are going to be detrimental to your lung health. And the most important thing for that is smoking.
When people talk about smoking, they often talk about how it causes lung cancer. But smoking is actually the single most important causative agent for bladder cancer. So smoking causes maybe 45 to 55% of bladder cancers. While it is a relatively uncommon cancer, almost every time it happens, it's because the person smoked. So, and interestingly, in the urinary tract, also kidney cancers, there's a significant risk for kidney cancers with smoking. So as far as bladder health is concerned, the only thing that I like to shout is stop smoking.
Because Jamaicans have a tremendous appetite for smoking. We did a study in Jamaica looking for the burden of obstructive lung disease, where we were trying to estimate the prevalence of a particular lung disease. When you speak to the average Jamaican, smoking on the lungs, lung cancer, that's what they know about. But they know nothing of the other impact of smoking on the lungs, which is chronic obstructive pulmonary disease. They know little about that because everybody who wheezes, the symptoms of COPD are identical to the symptoms of asthma. So we're not appreciating the fact that this is happening to me. But the difference is, with asthma, my disease is reversible. I can get good reversibility and improvement. With COPD, it's irreversible. So I will not get the relief that I was hoping to achieve as I would with asthma.
My name is Kurt McCammon. I'm the chair and program director at Eastern Virginia Medical School, and you're watching Caribbean Medical TV.
Be sure to subscribe to our channel for early access to our episodes. Stay tuned, and we'll be back with more.
I can see clearly now the rain is
At Guardian Group, we've seen so many of our customers achieve great things. From key moments when together we've planned for the future to those unforgettable days when you've celebrated the rewards of those great decisions. So, it's no surprise that after 175 years, our optimism is stronger than ever. Because when you've partnered with people to achieve their best lives as long as we have, you tend to see the world a little brighter every day. Guardian Group. Live easy.
PAHO has found that within Latin America and the Caribbean, cancer occurs in men 20% more than compared to women. And the top 4 cancers which threaten men are lung, colorectal, prostate, and bladder. Prostate cancer can be slow-moving, or it can be quite aggressive. So awareness of prostate cancer is our focus. Let's hear more from our experts.
I am Richard Mayhew. I'm a consultant urologist at the University Hospital in Kingston, Jamaica. I'm really pleased to be here with Caribbean Medical TV as we continue to encourage men across the region to look after their prostates. Prostate cancer remains a difficult disease in our region. We have a high incidence, and even more concerningly, we have a high mortality rate. Whether you're in Jamaica, Barbados, Trinidad, we have the same experience all over. And while we may not be able to do much about who gets prostate cancer, what we can do a lot about is who survives prostate cancer. And a large part of surviving it depends on being diagnosed early. When it is advanced, we really can't do much about getting rid of the disease. So I encourage all our men, wherever you are in the Caribbean, to start getting your screening done. Choose a doctor that you have a relationship with and just see them once a year. And hopefully the life you save might be your own.
Way too many men are dying from prostate cancer in the region, from Jamaica to Guyana. And if I had to say one thing to Caribbean men, it would be to continue or to consider getting screened for prostate cancer. And we need to be clear that prostate cancer affects all men, regardless of race. But what we found in countries where there are a number of different races, it tends to affect men with Afro-Caribbean ancestry disproportionately. So in Trinidad, it affects men of Afro-Caribbean ancestry 3 times as much as those with Indian ancestry. However, any man can get prostate cancer. And if I had to say one thing to you, it would be to get screened.
Generally speaking, men over 45 should have it done annually. But if you've had a family history, by that I mean your father or your grandfather or your brother or a sibling, male sibling has had prostate cancer, you should start at 40. It doesn't mean that it only happens at age 40 or 45 and above. You can get it in your late 30s as well. But it's very, very rare and unusual. So practically speaking, we recommend age 45 plus. And for those who have a family history, recommend 40 years and plus.
If it is that you would prefer to do it less than the required times, if you say, well, I don't think I can manage it every year, I'll do it every 2 years, explore that option. But when you consider the consequences of not checking at all, which is then possibly death, I think everything else would pale in comparison to that.
The trouble with prostate cancer is that it starts off and the man is not aware of it unless he has been doing his screening. He has no symptoms at all in the early stage. He doesn't know he has a problem. The doctor may do the DRE and find a lump, a nodule, a bump, and that rings an alarm bell. We need to investigate this. So the rectal exam called the DRE, digital rectal examination, is critical for the physician to be able to pick up most diseases of the prostate. Not 100% accurate, but certainly a great guidelines and great indicators are given by simply putting that finger in the rectum. And it's not painful. Your finger is lubricated as a glove, and a lot of information is gleaned just by putting that finger in that prostate because it's situated right within the reach of the finger.
The first thing I probably want to convey is that we don't want to wait on prostate cancer to become symptomatic. Now, the difficulty we have with prostate cancer is that if you have prostate cancer, which is causing symptoms, then more than likely you're looking at advanced disease, which is not when we want to diagnose it, because with advanced disease, we actually can do very little to cure. We are trying to diagnose when you are early prostate cancer, and in that setting, you will have no symptoms. In the effort to pick up asymptomatic disease, then we stress the importance of prostate cancer screening. As far as symptoms now for the advanced disease, what men may notice is urinary symptoms such as difficulty passing the urine. They may have blood in the urine. Some men have enough difficulty to go into urinary retention. However, there are also other symptoms which are non-urinary. So patients may present with bone pain from spread to bone. They may present with loss of weight, loss of appetite. They may present with renal failure because of obstruction. They may present with swelling of the legs. So the symptoms are varied, but I stress again, we do want people to be assessed before they might be symptomatic, rather than waiting on symptoms to occur.
It's critical. It will make a big difference between a good quality of life, a cure, and a horrible quality of life. In fact, if prostate cancer goes really fulminant, it attacks your bones in the very marrow that you make your red cells in. So you're going to get anemia, severe anemia. The bones are going to become brittle, they're going to break. If the spinal bone break, the vertebral bones break, it pinches your spinal cord. You know what happened to you? You're paralyzed. Is that what you want? When you could have made a difference 5 years before that? No, I always say that if a man dies from prostate cancer that spread to his bone, he has been a slack man because he could have made a difference. And it's so simple to make that difference. We have our health, our good health is our responsibility, not your wives or your doctors or anybody else. Your wives will support you, but the buck stops with you. It's your life.
Thank you, Dr. Sao of Trinidad and Tobago. As we know, the impact of climate change poses a real threat, not only to men in certain industries, but to our overall health.
As global temperatures continue to rise and extreme weather events such as heat waves, hurricanes, flooding, and wildfires become more frequent, the health impacts of climate change are becoming increasingly apparent. Our biology does not make us isolated from the effects of this. The impact of climate change on our health is multifaceted. Heat waves, which are becoming more frequent and intense due to climate change, can increase the risk of heart attacks and strokes. High temperatures can increase blood pressure, placing a strain on various organs, which can further increase the risk of major health issues. Temperature change also has a significant impact on the availability of crops and the extended food supply that nourishes us. We, the Caribbean people, are net receivers of climate change, and collectively we must adapt to the realities of climate change on our health. We can raise awareness, educate and empower our families, friends, and our social networks about the impact of climate change on health. We can all help to preserve the lives of our Caribbean people by taking action to adapt. It just takes one action to cause a chain reaction of change. And we need to take that step today. Visit our website for more information on what we can all do to help. Stay tuned to Caribbean Medical TV. We will be right back.
Social investment has always been an integral part of the Republic Group's DNA. Our Power to Make a Difference program is the primary mechanism through which we achieve this objective.
We recognize the importance of the elderly in all our communities. We are so happy to be able to partner with the home to the tune of $80,000 to be able to add this wing so that the residents can be more comfortable.
The home has residents from around the entire island. When we have corporate sponsors like Republic who operate here in the community, it sends a message that we hope and pray would be emulated by other corporate sponsors.
This initiative is one of the many projects that we have undertaken under the Power to Make a Difference program.
The Caribbean Urological Association annually hosts their all-important international conference, where collaboration brings forth an ongoing, ever-evolving new frontier in men's health.
Advances in urology have taken place in the Caribbean over the last 20 years, particularly because of the relationships that the Caribbean Urology Association has with the American, the British, and the International Society of Urology. And they have sent down experts, professors to give us hands-on training in the Caribbean. And this is how we develop procedures like radical prostatectomy to cure prostate cancer, brachytherapy to put seeds into the prostate, again to cure prostate cancer. And then we've moved on to reconstructive urology, urethroplasties, which we couldn't do prior. We've gone on to laser surgery, and all the laser surgery that we do today, shattering stones and so on, have come because of workshops done in the Caribbean. You know, so we could shatter stones, we could do prostate surgery, we could enucleate the prostate, vaporize the prostate, and so many advances, all because of the experts that have come to the Caribbean, not just in Trinidad, but also in Jamaica, in Bahamas, and so on. And we also have Caribbean urologists who have gone from island to island exchanging their ideas. So a lot of what you see today, which is the cutting edge of urology, things that they are practicing in the US and Britain and other countries, we are doing it right here in Trinidad and in the other Caribbean islands.
I have decades of trauma experience and have been involved in a leadership level with a number of organizations. So I was able to sort of share ideas with the folks here and talk about trauma systems and trauma care in general, optimal interaction between the urologists and the trauma surgeons, and really try to help the training programs and the practicing urologists sort of imagine an optimal approach to both teaching and practicing trauma for urologic injuries. And in addition to that, my other practice focus is in reconstructive surgery, so urethral strictures, complex genital and urethral reconstruction.
Well, I have worked at various countries over the past 20 years. I've traveled to Jamaica primarily, but also here Trinidad and also to the Bahamas and even Bermuda to work with the urologists. I've been working with them with regard to reconstructive surgeries, urethral injuries and strictures, working along with penile injuries and conditions of the genitalia, cancers of the pelvis, prostate cancer, even bladder cancer, and also working with them in the clinics, but in the operating room to do surgeries. My message to the Caribbean people is that the healthcare providers here in countries in the Caribbean really is superb. The commitment that I've seen by my colleagues here are really outstanding, and it reaffirms our purpose as care providers.
So we've actually had a great collaboration with the Caribbean countries in a number of different aspects. We've been coming down doing surgery and teaching for about 10 years now. We've also developed a collaboration where we're projecting our grand rounds to the Caribbean Urologic in the past. I work with also an organization called International Volunteers of Urology, and that organization has been coming to the Caribbean also for 15, 20 years, working with the local urologist throughout the Caribbean and teaching different types of surgeries. The most important thing is to collaborate so that they understand and they learn the techniques so that help your patients as we leave, because we can't treat everybody when we're here.
I'm Dr. Michael Coburn, the Department Chair for Urology at Baylor College of Medicine in Houston, Texas, and you're watching Caribbean Medical TV.
Staying healthy is essential, but sometimes the weight of our daily responsibilities can feel like a burden. Patience and support is key. There is no judgment in asking for help and for seeking guidance.
As they said, an ounce of prevention is better than a pound of cure. So we want persons to please seek medical attention. Once you have any health issues that may be bothering you, you do not wait until it gets worse. And as a matter of fact, we don't want to wait until you come down with a health condition. We want you to start now. Whether you feel right or you feel wrong, you start now.
I think every year, especially if you're a man, for example, you should have your blood sugar checked, have the hemoglobin A1C checked. Obviously, your blood pressure is incredibly important. Have your PSA, prostate-specific antigen, checked, and then have a screening colonoscopy at least every 5 years, or a test. There are now a number of tests to look for blood in the stool as an early sign of colon cancer.
So this is when you pass a sample, take it to the lab, and it's assessed. That has to be done annually. So every year, you can't forget that one. If you're doing a colonoscopy, it's every 10 years if we don't find anything. So again, it's something which can be managed by individuals. You can also do a CT scan. So if you don't want an invasive test of the colon, You can discuss with your doctor to make sure that it's available in your location. But a CT scan of the colon can also be a screening test for colon cancer. It's done every 5 years, for example. So these are some of the options available.
If the first thing you see would be blood in your stool, please don't wait. It may not just be a hemorrhoid, because we do have colorectal cancers. More men would probably say, yes, just a hemorrhoid, and they would not check. I know the females will more easily, readily go to their physician to have it examined and to be more comfortable. Because if it's just a hemorrhoid, fine. I always advise, once you're at the screening age, let's go ahead, have the colonoscopy done so that we're sure and we do not miss any type of cancer.
Men, you need to take care, you need to take precautions, you need to do your screening, you need to try and be as healthy as possible and not ignore your symptoms.
If we develop that level of consciousness, I believe that it would be reflected in even when we visit our physicians. And for example, in a case where a patient comes to me, I would want a patient to be able to tell me, look, this is my lifestyle, this is how it is, so that they're honest with me, because an honest patient will be able to get us closer to the diagnosis. We will be able to diagnose things even more adequately. I believe that level of consciousness starts with us promoting and preventing more, right? Over the typical treatment and rehabilitation. Because once we push promotion and prevention, we'll have less of treatment and rehabilitation. So I think that is one of the points, take-home points I'd like to stress.
From a male perspective, you have to take responsibility. Just like you take responsibility for being a good provider, being a good father, a good dad, you have to take responsibility for your own personal health. And don't use as an excuse, I have more important things to do with my finances or my time. It is your health, as I said earlier, is your greatest asset. You have to take care of it. It doesn't take care of it on its own. You have to pay careful attention by doing the things that are necessary to be in the best or in optimal health.
After my experiences, I think I'm qualified enough to say something about prevention and lifestyle. As soon as you feel you have a problem about anything to do with your heart, your breathing, please don't hesitate to go by a doctor to check it out. I never went by doctors. Another mistake I probably made. So you need to find out how you are at all times. Prevention better than cure, as they say, you know?
I'm Dr. Dolan Noel, an internal medicine specialist from Grenada and hospitalist. Now you're looking at Caribbean Medical, and I was happy for the opportunity to provide some education and enlightenment. I hope that you have enjoyed the program and that you may benefit from some of the things that we have said.
Thank you, Dr. Noel of Grenada, as well as all the specialists in today's enlightening episode. We hope you've learned a great deal from today's discussion on men's health. No man is an island. In community, there is unity. See you next time on another episode of Caribbean Medical TV.